Are you struggling with elbow pain? Here are 4 ways to fix it, 2 of which you've probably never seen before, and that we do every single day with our patients and athletes at Mobility Doc. We're going to address the way the muscle feels, the way the joint moves, and the strength to help coordinate those 2 things so that way you can finally get past this elbow pain. Let's start with muscle scraping. So we use the Sidekick instruments, one of our more favorite ones. We'll drop a link so that way you can find them easily, and if you like them, maybe love on us by using our link so we get a little love back. The protocol with muscle scraping is you want to not just go on the area that you feel it. Resist just going right to the bullseye. You want to cover everything around the forearm, the front of it, the back of it, into the bicep. Yeah, at the site itself, but beware, if you focus too much right on the hot spot, it could be a problem and you could just create more inflammation. So what you're going to do is you're going to scrape back and forth, and you want to make sure you don't just go in one direction. You're going to change the direction you're moving. It's important to do that so that way you break up that scar tissue and allow it to heal in a more normal orientation. If you picture spaghetti, it should look like straight strands of dried spaghetti instead of this mishmash mix of tangled muscle fibers. So you're going to go all around the area. You can add some movement if you want to. You don't have to be still while you're doing it. You're going to get on the outside of the elbow too. Some of you might have outside elbow pain. Many of you might have inside elbow pain. It just is a little bit more common with grip strength problems. You're looking for that gritty, bumpy, gravelly feeling. If you're unsure of Mulligan Technique, we cover this in other videos that we have. You can get it right on our YouTube. We'll link to that too. And then after about 2 to 3 minutes of going back and forth all around your elbow and forearm, a little bit below, a little bit above, then you're going to move on to the next part. Next, what we're going to do is use muscle flossing, which also gets a little bit of that same idea of breaking up the connective tissue, but what this does is it actually constricts on the muscle more tightly, which interrupts with blood flow, and then helps when you take it off to bring fresh, clean blood in. It's a way of stimulating healing. It's almost like a non-invasive form of PRP for those of you that are aware of it. I'm not saying it is PRP, but it's a similar idea in that you're trying to bring all this blood and these platelets, all the things that you need inside your blood to help you heal. This can help with that, but also it breaks up that scar tissue. You're going to need to plant your arm down. If you have a friend, it's a little bit easier. I'm going to show you how you do it if you're a lone wolf. So, arm comes down. This could be the side of anything, but I'm using this little stabilizer just to begin to get the band down. You may see me struggle the tiniest bit, but once you can get the bands kind of on the area, what you can start to do is loop right over top of it just to get a connection. And then once you start to get that connection, it will tighten. So now I actually can pull a bit. So what you're going to do is you're going to start to pull, and I'll put my hand like this so you can see a little better. I'm going to pull out, and then I'm going to come around and down. I'm going to pull out, around here. I'm going to go about to mid forearm, and then I'm going to start coming back up just so that way I can get above my elbow a bit too, or right at the joint line really. So I'm going to get right on this part of my elbow, just about where the forearm connects to the upper arm, right where it ends, right at that joint. And once I get it here, in this case, I'm just going to tack it down. I'm just going to hold it with my finger just to keep the band attached. You're going to go through movement. So the movement you're going to do is wrist flexion, extension, supination, pronation, coming in and out with your elbow. What you're doing is you'll feel the muscles of your forearm, of your elbow. You'll feel them sliding and gliding underneath this band. And you'll start to see your hand go white because you're actually interrupting blood flow. But it's important that you do that. After about 30 seconds or so, you should start to feel the your fingertips get a little tingly. That's very normal, again, because we're interrupting blood flow. Once we do about 30 seconds of that, you're going to take this off, If you happen to kind of like tie the band underneath itself, make sure you can get to it. I feel instant warmth rushing into my fingertips. I feel warmth into my forearm. What I've done is I've allowed blood to come back into the area. You can see possibly like the lines in my forearm from how tightly I had it in there. If you're using at least a good enough screen and if my camera's catching it. Now what I've done is I've sufficiently broken up the adhesions and the tension that's at my elbow. What I'm gonna move on to next is something that I don't think you've probably ever seen before, which is Mulligan Technique. Mulligan Technique is all about helping the joint to track properly. The idea is you have these little positional faults, is what he calls them, which means the way that the elbow is moving is a little off its axis. It's like a sliding door that's a little stuck. And what you need to do is encourage it to get past that point and get back on track. So the band that I'm going to use now is not special at all. It's just a resistance band that's really strong, so that way I can't move it a lot. But the band and my movement is helping to get my elbow to be back on track after I've eliminated the muscular reasons that would be interrupting that. So let's come back. I've anchored this band, which I said, again, there's nothing special. This is one of those pull-up assistance bands. It's a longer band that you see at pretty much any CrossFit gym or strength gym. And this, I've just anchored to something strong. You could use a squat rack, a half rack, a rig, anything that's not going to like pull into you. It's important to be safe. And remember, make sure that you've examined your band, that it's not going to break. You're going to place the strap right at the elbow, but on the forearm. What I'm going to do with my hand is I'm going to actually come underneath my upper arm and I'm just going to lock it there. I'm going to walk myself out a little bit and stabilize with my legs. And then what you're going to do is you're going to bend and extend. I'm going to flex and extend at my elbow so that way I can reposition the movement of the joint at my elbow. So again, I'm getting about as much tension as I can without turning it into like I'm like gritting and like straining to do this. Once I get about maybe 30% tension in this band, I'm going to come up and down. If I didn't hold on to my arm, I wouldn't be able to get the same effect because I'm too tight through my bicep and through my upper arm, and I'm using my shoulder now to hold it here. So you need to use this hand, this other arm, to keep you in place so that way you can more freely move through the upper arm. You would do this in both directions. So now I'm pulling in the other direction, and now I'll push against it with this hand, the upper arm that is, and now I'm bending and extending. What you should feel is an instant change in the way you're experiencing your pain. It should decrease the pain. For those of you that have so much pain that just moving your elbow, your hand, your forearm, this will be really obvious. Some of you, it'll be a little less obvious. What you're gonna do though is you're gonna perform 2 to 3 sets of about 10 reps in each direction. And as you're getting comfortable with it, moving through, playing around with your position so that way you feel nice and comfortable. You could always test and retest before that. Pretty much gripping anything is going to be an issue. So if you have a weight near you, you could even hold that weight and see like, okay, do I still feel that pain? You can always do more of that mulligan exercise if it feels right. This last part, the 4th exercise, and I'm doing this in a very specific order on purpose because this order will be most beneficial for your rehab at home. I'm gonna use this little stand to stabilize my arm. And what I'm gonna do is I'm gonna hold on to a dumbbell on the bell portion of it. So the idea is you need this to be stable because if you're just holding your arm up, you're involving too many muscles. I'm really trying to isolate the muscles of my elbow and forearm at this point. The most important part about what I'm about to show you, I'm going to tell you in a second. First, let me show you how you're moving. The basic idea is I'm coming down and I'm coming this way. So it's this back and forth movement. It seems absurdly simple, but it is one of the most important strength exercises you can do for getting strength into the elbow and also getting rid of that elbow pain, because you're teaching the tendons in your forearm and elbow to be okay with the stress, to be okay with the demand of what you're doing, so that way you can do the more significant things, the more specific things that you want to do. The most important part about this, let's get back to that, is you're only doing the descending, the decelerating, the negative portion of this, which means I'm only going to lower down, and once I lower down, I'm just going to use my hand, my other hand, and bring it up. So I'm only focusing on coming down. Once I get down, I'm bringing it back up. I'm not just coming down and up like this. The reason being is we're doing an eccentric exercise, which only focuses on the lowering. And the reason we're doing this eccentric exercise is because an eccentric exercise targets the tendon itself, and the tendon is what we need to get stronger, to get thicker, to be more durable. So that way, when you add back in your normal activities that were a problem, they're no longer a problem. Scientifically, there's an incredible amount of research around eccentric exercises, because you can use lightweight and have a similar effect to heavyweight and get a good bit of hypertrophy and strength gains just doing the eccentric exercise. So for a little bit, you might not be able to do a whole lot of grip strength work that's very heavy, just because of your elbow pain, but that's okay if you focus on these eccentric exercises. So you are going to do 10 in one direction, and then bringing it up, 10 in the other direction, bringing it up. And then if you want, we could also do 10 lowering into extension, bringing it up, doing the same thing, 10, so just lowering down into extension, bringing it back into flexion with your other hand. You could even just like pull it out, bring the hand up if you want. And then the last one would be, you're going to stick your palm down or supinate, and now you're lowering down this way, and then coming back up, lowering down, coming back up. There'll be 10 in all directions, 2 to 3 sets of it, depending on the time you have, and depending on how it feels. The more you do is not always better, but if you can tolerate more, do more. And if you can tolerate doing too much more, you should add weight. This is obviously a very lightweight, it's only 4 pounds, but start light, go heavier. When you can do that and feel absolutely no pain and have no difficulty, then you should not have any problems anymore with whatever the activities that you're doing that involves your grip. First and foremost, thank you for watching, but also feel free to ask us more questions and comment, follow us, and maybe share this with some friends, because like I said, at least 2 of these 4 are things that you've probably never seen before, and one of the #1 reasons why people don't get past a certain point with their elbow pain, with their medial epicondylitis, lateral epicondylitis, golfer's elbow, tennis elbow, because they're only doing one part of a more complete thought. And unless you do all of those parts, you're not going to get all the way better. Stay in there, spend about 3 weeks or so doing it. Feel free to ask us for more information. If you need something a little more personalized or customized, reach out to us and we can help guide you on how we can do that for you.